um, I'm happy brief you. I don't know who the question that you asked for, but I'm happy to brief you on behalf of the PRCS.
Sure. Okay. Certainly. Thank you. And what we're looking for is what we really want to know is the current situation of medical facilities there, what the need is immediately right now, and what can be done by the international community to get aid to the people of Gaza to alleviate their suffering. So if you could comment on that, we'd greatly appreciate it.
Sure. Well, thank you very much for this opportunity. I'm Hani Sholi, the head of the emergency appeal for the Palestine Red Crescent Society. The answer to the question is basically in terms of the current facilities. As you know, both infrastructure and residential structure in Gaza, it's you can say it's nearly totally destroyed. So all our facilities or our hospitals or our medical facilities, most of them have been either damaged or destroyed. We had two hospitals in Gaza, Al-Amal Hospital and Al-Quds Hospital. Al-Amal Hospital is still partially functioning, and the Al-Quds Hospital was damaged and got out of service on November 10th of last year. We have mobile clinics, and we are trying our best to provide health, not just health, but emergency medical health, as well as relief and other emergency response services and aids to the IDPs, and going with them and following them from north to Rafah and then back to Khan Yunis. So the short answer is the infrastructure, the facilities are either damaged or out of service right now. The needs are basically massive, and you can get more on the needs and the areas of needs and the sectors and the priorities from our emergency appeal information website on the Palestine Red Crescent Society, and the needs are in the in the health and medical areas, from medicine, medical supplies, and medical equipments. In terms of relief, we're talking about nutritional and food assistance is needed, as well as the wash and other supplies. As you know, the Rafah crossing was basically got out of service and was closed after the latest incursion and latest campaign in Rafah since early May. And right now, we're not getting anything into Gaza. And if we do, it's just something negligible. Is not to the level of even getting the basic requirements and needs for people. So we're not getting anything that is of any significance because Eretz crossing is closed, and as well as Rafah and Karam Abu Salim as well. So that's where the situation is. In terms of your question about the ways and means to help, this answer is twofold. The supplies and medical and relief supplies that I just mentioned are needed. The priorities are massive in Gaza. And also, we always tell that to our partners and to our friends that not just donating assistance and funds, we also need to ensure that this assistance and the donation gets in. So it doesn't help us if we get thousands of trucks are lined up in Al Arish crossing, but in Rafah crossing out of Al Arish, but they cannot get in. So we need also the political will to be able to get this assistance to the people who need it. So that's basically a brief answer to the question that was raised.